Hello everyone. Today's video is a Q&A video talking today about challenges from getting rid of or detoxifying from Candida / yeast, talking about colostrum, and talking about just some logistical factors around being able to take a supplement called Lactium and where you can source that supplement from. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind please taking a quick moment to like, share, subscribe, and or post a comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here, it says, do you mind talking about how a patient usually handles the removal of Candida and acetaldehyde from their system? My understanding is that the body can sometimes become reliant on it and even develop a sort of addiction to it, like if it were a drug like alcohol. So the removal of it can cause some serious symptoms. If this is true in your practice, what do these symptoms usually look like, and anything you can do to remedy and help transition the body? How long does it normally take for the body to adjust? So thank you for the question. Yeah, so I've had a few patients over the years who have really struggled with their yeast detoxification / yeast removal protocols. And I have heard some clinicians and like at conferences and certain books, articles, talking about this idea that some of the compounds that are produced by Candida can potentially be, like the body can kind of get habituated to them. And so I think that there's probably some truth to that in terms of why some patients really struggle with die-off symptoms. Now, when I'm talking, the types of symptoms that I would be looking for in that case would be patients just feeling like really brain foggy, maybe feeling depressed, having like really debilitating, or not debilitating, but like really like overwhelming food cravings for things like, say, like sugar and just like carbs in general. It'd be more like, I guess, kind of like behavioral type stuff that we might see, as opposed to more classic die-off symptoms like, having more gas and bloating, having some diarrhea, having maybe some abdominal pain, maybe some nausea, maybe some skin outbreaks. Those types of symptoms could come along with it too, but that more like almost biochemical dependence, or kind of like just physiological being acclimatization, if you will, to having those Candida produced end products. It's going to be more like a behavioral type thing, I think, or yeah, more behavioral type symptoms, I guess. So those would be the types of things to look for. Honestly, it's been really rare in my practice to see that. Like I could think of a handful of patients over the years that I've seen with those types of issues. Now, don't get me wrong, I've had many sensitive patients over the years where they really struggle with the anti-yeast protocol that we're working with, having various die-off symptoms. But in terms of more of those like, yeah, Candida compound habituation, detox kind of related symptoms, those are quite a bit more rare. Now, were I to have a new patient that came in tomorrow and had yeast issues, and we started a protocol, they started displaying some symptoms that suggested that type of issue, what kind of approach would I take? Really, it would be just pumping the brakes on the intensity of the Candida protocol. So if we were using, say, like a liquid herbal tincture, if I had them on, say, a teaspoon twice a day of that formula, I would drop it like way down to maybe like 5 drops twice a day. Or if the patient was taking capsules and I wanted them to be on, say, 2 capsules twice a day of X, Y, or Z formula, I might drop it all the way down to maybe a quarter of a capsule once a day and build up gradually from there. I'd also be, taking into account, of course, the types of symptoms they were experiencing. So if they were feeling really, anxious, or just feeling like really discombobulated, really spacey, I might bring in a supplement like taurine to help act as an osmolyte to help better regulate their neurochemistry, or maybe bring in some Relora, or bring in some Lactium, some supplements to help, to mitigate, say, if there's like anxiety that was coming up, or maybe some saffron if they were having some depression symptoms, or maybe try some glutathione to help just with their overall, like if they're having a lot of brain fog, feeling really spacey, something like glutathione or molecular hydrogen might be helpful. So I'd kind of look at it as we want to pump the brakes on the killing rate of killing, because we just want to reduce the level of Candida, of course, as fast as possible within the patient's tolerance level. But I would also look at damage controlling symptoms that were coming up along that process. maybe I'd use some targeted skin brushing or some herbal supports, like say things like burdock or nettle or oh my gosh, what's the one I'm trying to think of there? Ah, it's been a long day. Anyways, herbs that help to support like just overall, say maybe like dandelion leaf or something like that. It's not the one I was thinking of, but anyways, I would use like herbs that would have kind of a broad spectrum effect, like on helping with lymphatic system support and kidney support, liver support, just kind of maybe general detox support. I might look at that depending on the way the symptom picture was looking, but those would be the types of extra supports that I was think of. And then how long does it normally take for the body to adjust? Again, I've really only seen a handful of patients with that type of issue over the course of time. So, but speaking from my, I guess, fairly limited experience with that type of scenario, it's usually, if say it would normally take, an average of maybe 1 to 3 months to deal with the yeast issue for the average patient, it might tack on like an extra couple of months, give or take. Now, of course, if there are biofilms or other, concomitant factors, comorbidities at play, then it could certainly take longer than that, but that would be a rough, ballpark estimate. So hopefully that answered your question. If you have any follow-up questions, just post in the comment section below and I will do my best to answer. Next question here is about, this is what are my thoughts on Armra colostrum. So I haven't used Armra colostrum specifically, but I just thought I would comment on colostrum because I don't think I've ever talked about colostrum on here before, and it's just kind of fun to talk about new things or things that I haven't talked about before. So I use colostrum fairly regularly, so for folks who aren't familiar, colostrum is the first bit of milk that a mammal produces when they first give birth, and that colostrum is chock full of lots of important nutrients for the baby mammal that the mama animal is feeding. But then there's also a part of the benefits of colostrum is that they're really full of a lot of antibodies, because when we're born into this world, we really don't have an immune system that functions properly. So we don't have a fully functional immune system, I should say. So we start building one right away once we're born, but we get a lot of benefit from that colostrum and just breast milk in general from in terms of the antibodies that are passed from mom to baby. So with colostrum supplementation, it's something that we can get bovine colostrum in supplemental form, and that can be helpful as an immune system booster. So having looked at the research literature on colostrum, and my understanding is the majority of the literature has looked at the immune system boosting benefits against things like just common colds and flus, either preventing or reducing the likelihood of getting sick in the first place or shortening the duration of sickness. So that's the main reason that I use it in my practice. But I've actually had a number of patients who have found a lot of gut health benefit to taking colostrum, which has been really nice to see. So it's those are kind of the two areas that I see it helping with. But I haven't used it for gut health promotion in a lot of cases, but I have maybe half a dozen patients who have found that it's been helpful for the gut health. I was prescribing it for other reasons, or maybe they started taking it on their own and then they're like, oh, it's been helping my gut. Like, great. But many patients don't see a benefit from that, but it does help sometimes. And then in terms of helping to mitigate or reduce the likelihood of getting sick, so patients, they take it before they go on on an airplane flight, or they take it if they, they're teachers, or I recommend it for kids and, it's cold and flu season. I feel that it has, from my experience, my observational experience, I feel like it does help to minimize the likelihood of getting sick. One little note about colostrum is that it is, of course, derived from dairy, based on where it's coming from. Of course, it's from dairy. Each capsule of colostrum, at least in my experience, the product that we use here, which is called IgG Protect, it's made by a company called Orthomolecular Products. I have no financial affiliation with them. That's just who we happen to use. They have a good price point on it. Easy to get it in Canada. I believe it's 1 gram of colostrum per capsule. So even if a patient's, say, taking 2 or 3 or 4 capsules a day, they're really going to be getting less than the equivalent of 1 teaspoon's worth of dairy. So it's, even patients who are dairy sensitive, I find that it's usually well tolerated. But if I had a patient who was really, really sensitive to dairy, then I would be very cautious with recommending that. I probably would not recommend it. I'd recommend something different. And then let's see, the last one here is right. So I posted a video fairly recently about a supplement called Lactium. Can be very helpful for reducing anxiety, helping to promote sleep, helping to promote overall calmness. So if any of those things sound like things you're interested in, then please check out that Lactium video that I posted recently. But there's been a few comment or questions in the comment section about, can I take Lactium if I am sensitive to dairy? So I thought I touched on this in the video, but maybe not. I don't mind saying it again here if I did touch on it. So my understanding is that Lactium is a 10 amino acid long chain, and my understanding is that the immune system is only able to recognize amino acid chains that are at least 12 amino acids in length. So it seems that it's short enough that it kind of bypasses that dairy sensitivity mechanism. So clinically, I have not seen any issues so far in patients who are dairy sensitive and they're taking Lactium. That being said, this is not medical advice in any way, shape, or form, and definitely talk to your healthcare provider about that. But if you're thinking about taking Lactium, but my understanding is that it's in my practice, I don't limit my patients' access to Lactium if they are dairy sensitive. But of course, I tell them that it's from dairy and that it should be okay. And so far, it's been fine. Now, if I had a patient who had an anaphylactic reaction to dairy, I wouldn't prescribe them Lactium, just err on the side of caution. But I've never had a patient with anaphylaxis to dairy that I can think of, anyways. So it hasn't been an issue so far. And then the other question that keeps coming up is, where do you buy Lactium? The only supplier of Lactium that I know of in Canada is the company Signature Supplements. I have no financial affiliation with them either. They make several different products that have Lactium in them. There's one called Rest Reset, one called Stress Reset. I think there's maybe one called Nerve Reset or something like that. But then they actually do just have a straight Lactium supplement as well. And then there's also a company called Pure Encapsulations, who I believe are from the States. I know we get their products up here in Canada too. I just don't prescribe their products. Nothing against them, just haven't used their stuff. And they have a product, I believe it's called like Serentien or something like that. It's Seretein, so however that's pronounced. And maybe Serentine, I don't know. Anyways, there's Lactium in there, I believe, and they may have some other products that have Lactium in there too. There's, I'm sure, other companies out there, but those are the only ones that I am specifically aware of. So that's where you get Lactium. I hope this is of interest. If there's any comments or questions on these topics or anything else, please post in the comment section below, and I will do my best to answer as soon as I can.